Since we talked about that going to make us live longer, some of us may want to go out for a new, a freshened up look as we age. We all want to look our best, but at what lengths are we willing to go for beauty? Since the dawn of time, women have concerned themselves with beauty and the art of looking good.
Oh, of course it can do a lot for a lady, 'cause it helps to show a man what she's got. First you push it up here, pull it down there, tighten up the middle till you're gasping for air. Oh,
bigger breasts, smaller waists, higher butts, straighter noses, or wider eyes. We've gone to all sorts of lengths to achieve our ideals and to try and look younger and better.
Foxy lady.
Today, there is a dizzying array of treatments and options to choose from to help us all look more beautiful. From temporary topical solutions to extreme overhaul plastic surgeries. Whether you are looking for an easy change-up or a more serious body procedure, what lengths and at what costs are we willing to go? And joining us now are dermatologist and psychiatrist, you are both, Dr. Amy Wexler, finance expert Jean Chatzky, and Alex Plotkin, who at the tender age of 29 has already had an awful lot, some procedures done. You know, I look at you and you're a really pretty girl. I can't imagine, why did you do that?
Well, I actually did it preventatively. I've gotten Botox and Dysport treatments on my forehead, my crow's feet, and my 11s. And about 7 months ago, I got some Juvederm in my lips.
And you're happy with the results?
Oh, absolutely.
I mean, this is costing you a lot of money to do this preventative work. I mean, do you see a lot of patients that want to do that?
I see a lot of patients who want to do it, but a lot of the times I talk them out of it.
Would you have talked her out of it?
Well, I don't see her beforehand. I do
Right.
what I call baby Botox on younger patients, where I use little tiny doses to prevent lines. You can see sometimes a line that you're starting to get that maybe your mom or your grandma has.
But don't you think that maybe we are a little over the edge to want to do that much work at such a young age and be so concerned and preventative?
Well, I think that Alex works in the field, and that can be what happens. You're exposed to something and you want to do it. It's just, where do you stop? So I use my psychiatry background to help people stop sometimes when they want to go overboard.
We should all have a dermatologist who's also a psychiatrist.
Yes, I know.
I think so. I'm gonna just
one-stop
take you home.
Well, okay, so what is the procedure that most people want to seek these days, and why do we go to such lengths to have this beauty?
There's a lot of pressure for women, of course, to look younger. And now with the economy and people worried about losing their jobs, they're worried about losing their jobs to younger people who would require lower salaries.
Right, younger, cheaper people.
Yes.
We've had a lot of talk about de-aging your resume, and I think people feel like they also need to de-age their face.
But it's expensive. How much money, Alex, do you think you've spent so far?
I would say about $1,500.
Okay, so I guess my question is, if you feel that you need to do that to keep up, do you take out loans? What do you do?
I really don't think that you take out loans. I think that you make choices. I think, look, we all do many different things to improve our appearance. We go out and we buy new shoes. We go out and we get new clothes. We get our hair lightened. We might be able to do one of those things, but not all of those things.
Exactly.
So you make choices.
I know this woman out in Long Island that lives by me who decided she wanted to have her breasts augmented. She was a stay-at-home mom, and she and her husband said, we can't afford it. So she went out and got cleaning jobs, cleaning houses to get enough money to be able to pay to have her breasts done.
That's great. That's perfect. She had a goal. It could have been a new car. It could have been a new house. It could have been a vacation. She decided what she wanted. She earned the money, and then she bought it. And that is the way that life is supposed to work. We're not supposed to float our plastic surgery on credit cards.
Okay, but let's just say that you really feel like you are going to lose your job if you don't do something about the way you look. How do you pay for it?
Well, then maybe you do. Do you take plastic?
We do. We take
All right.
plastic.
So maybe you put it on a credit card or a debit card, but you think about, I'm charging $3,000. How can I immediately start cutting back my expenses so I can pay off $300 a month and get rid of this debt in under a year? Let's do it with a plan. Let's be conscious about it. I'm not saying don't. I know the job market
I've
is
had
hard.
a lot of patients who come in lately in the last couple of years say, I've decided to do this treatment rather than buy a new handbag. Last year's handbag works fine.
Or a new car or something like that. So
Exactly.
did you give up other things to be able to pay for the treatment?
I did not. But you can use Care Credit and pay with no interest over, I think, 12 or 18 months if that's something that you want to do. I did not do it that way.
But are you going to continue
and you have to be very careful.
Yeah, exactly. Are you going to continue to get more treatments?
Oh, absolutely. Definitely.
All right.
I don't want to go
News
back.
about a lot of these treatments is that they last a long time. You can go in once a year, for example. So
And we're going to
that's not
show
so
that
bad.
in a few minutes
Yes.
because we are going to have an actual treatment with the patient here on the show. She's going to put some fillers in. Expensive, we're talking Botox can be from $500 on up. We've got fillers are about the same on up,
$500
depending
on
on
up.
how much.
Right.
You can, it costs a lot for nose, for get your nose
Lifts and
fixed,
things are
etc.
talking
Costs
thousands
more.
of dollars, $5,000.
Yeah, okay. All right, Alex, thank you
Oh, you're
for
very
sharing your
welcome.
story. I know we put a little
Absolutely.
heat on you, but we appreciate
fine.
it. Thank you all for being here, and you'll be back in just a couple of minutes. Okay, Janice, you are going to want to watch this. We are back with Dr. Amy Wexler and her patient, Mia Weinberg, and now we're going to talk about facial fillers and how they really work. Mia, thank you so much. Have you ever done this before?
I did do it once about 2 years ago.
Okay, and so tell us what this is all about with these fillers. Fill me in about them.
Sure. Juvederm is made from hyaluronic acid. Hyaluronic acid is naturally found in the skin and joints. And so what happens as we age is we lose some of it just from aging, and the filler puts back in the volume.
All right, so why don't you start working while we continue
Okay.
to talk? Are you nervous?
No, a little
You're
bit.
okay?
but I'm okay.
A little bit.
I'm
Okay,
gonna
nothing
hand
like having
you-
something
No,
done live.
no.
This little TV.
Stress ball, okay? You can
Okay, I've
squeeze
got
that.
Squeeze that, and I'll hold your arm if
All
you'd
right,
like.
okay.
And so basically, she's not had any kind of numbing procedure to her face.
Correct, because I'm using Juvederm XC, stands for extra comfort, mixed with lidocaine powder. So it immediately anesthetizes and numbs the area. It's much more comfortable. It's really revolutionized.
And so as you're looking at her, you just tell us
Yes.
as you're starting to work.
Sure, I'm just going to clean your skin with a little alcohol.
Okay, and,
And we're going to fill in these nasolabial folds, so that line from the nose down to the corner of the mouth. If you smile for a second, you could really see it.
Mm-hmm.
And it gets deeper as we age, and so I'm just filling it back in. It'll look very natural.
Okay, and this is a process that as we're watching, I mean, obviously we're going to continue this process during the course of the show. So an average visit to do this is how long? What, 15, 20 minutes? Maybe a little bit longer?
A little bit longer because we ice afterwards.
Mm-hmm.
But let's say a half an hour.
Okay, but the bottom line is this is something that you can do and it's almost immediate results.
You can do it at lunch, like we used to call the lunchtime peel. You can
Yeah.
do lunchtime filler.
Ooh,
It's different than it used to be.
It's completely different when you go back to the office.
Right.
Okay.
Okay. So Mia, eyes closed.
Okay.
You're going to feel a little pinch initially, and then you're going to get really numb. Okay. You ready? Mm-hmm. A little pinch.
Okay.
Are you okay?
Yeah.
Okay. So your upper lip will even feel numb from the lidocaine. It's temporary. It's almost like feeling like you've been to the dentist. You okay?
And then
What-
you have an ability to maneuver this stuff around, as I understand
Well, it stays where we put it, which is great, but it is pliable, meaning
Right.
that you can, and it's very soft to begin with, so it won't bump up or feel firm into the surface.
All I mean is that you can
Yes.
twiddle with it a bit
I
right now,
can.
but after that it stays in place. And it will
Absolutely.
last for how long once you're finished?
Up to a year. It's the only dermal filler that's FDA approved to last up to a year, which is really great. So coming once a year to the office is really pretty easy for most people. How are you
once to
doing,
the
Mia? You
office?
okay?
Okay. Yeah.
Coming
you
once
might-
to the office at lunchtime, not bad.
Right? You may come more frequently for other procedures, but for your dermal filler, once a year.
And
How
this
do you
is
feel?
safe? It's been well tested, obviously.
Well
but-
tested, absolutely safe. The only issues are you can get a little bruise from the needle, a little swelling. That's it, all temporary.
Would you do this on yourself?
Yes.
Okay, well, you keep working.
Okay.
And we are going to let Mia sit here and relax and use her stress ball. And then later in the show, we are going to reveal the results. So stick around. Can't wait to see how you look. Sarah?
All right, I want to see how she looks too. When we come back in 60 seconds.
Plus, it's one of the most common cosmetic procedures out there. There is a filler procedure going on right now here in our offices. And we'll show you how it worked out later in the program.
We're keeping an eye on our Juvederm procedure. The reveal is coming up.
Wonder if he got any numbers. Anyway, earlier in the show, Dr. Amy Wexler gave a facial filler injections to her patient, Mia Weinberg, and this is Mia getting it done. And I think we are all dying to know what Mia looks like right now. So, da-da-da-da-da-dum. Let's take a look. Mia, after. Wow, check it out. How do you feel? There you are before, and there you are after.
I feel great.
Do you? And it's not numb anymore?
No.
Okay,
The
so
numbness
you've
is
looked
gone.
at yourself in the camera, and what? Just look, compare. What do you think?
Wow.
Can, do you,
Yeah, I haven't seen the comparison. It's great.
Okay, so Amy, in doing this procedure with her, you were aiming to make sure that you took away kind of the
The deep
the
fold.
deepness in there.
Exactly.
And how many, it took you, during the course of the show, maybe 15, 20 minutes?
Not even that long.
Okay.
And it was so easy for her to do. Her body language was very relaxed because she wasn't in pain. And when I asked what the pain rating scale was on a 1 to 10, it was a 2.
All right. Thank you for being so brave as to come here and do it on camera, because I know that's a huge step.
Yes, you did great.
We really appreciate it. Thank you, Amy. Come
You're
back
welcome.
anytime.
Thank you.
All right.
I will. My pleasure.
Okay. When we come back.